Oregon hasn't been proactively looking at what they can be doing. I think our state had, back when they implemented the law, they wanted to take baby steps and kind of start the program, slowly start adding people to be using it, but it's just really lagged. It hasn't taken up a lot of momentum, and honestly, I don't know if they're looking at what other states are doing that they can be implementing.
This question may be from left field, but are pharmaceutical interests and the big amounts of money that they have a factor?
It definitely could be. I know that the legislature has had this bill come up in the past to expand parts of the PDMP, and it hasn't passed, and it could be because of a lot of other interest groups.
Given that a lot of these changes, a lot of these recommendations require changes to state law, were any of these findings a surprise at all after you assembled it, considering what the law is?
It was surprising when we looked at other states how narrowing our law is. It really limits their ability to do a lot.
And I'll just add to that, one reason it got on our plan is, obviously there's an opioid epidemic nationally. The governor has declared an emergency state here in Oregon, so we obviously have some compelling reasons to do it. But as we did our risk assessment for audit plan, we looked at what are the entities overseeing this. Oregon Health Authority had the PDMP, and so that's where we kind of honed into, and that's why we got there. But your question about in terms of why the state hasn't moved, one thing we acknowledge in our report, we want to make sure there's privacy issues here in play, right? We're talking about patients, their medical histories, their use of prescription drugs. So we understand that, we acknowledge that. There are some interests that are concerned about those privacy issues, but our recommendations actually account for, obviously we want to account for that balance, but these same groups who may oppose it here are usually national type groups and these other states have been able to compel to their legislative bodies a more robust PDMP system. So
yeah.
I think but just to answer your question, I think there's a lot of concern in Oregon about privacy, maybe as opposed to other states, the emphasis on that.
Yeah, there are a lot of mitigating controls that other states have put in place to make sure that you don't have, law enforcement roguely looking in a data set. And there's, every time someone logs in, it's monitored. You have to get a login and register, and then someone can look and see what you're looking at and why you're looking at it. There's requirements in place, so there's a lot of controls to make sure it's not being abused.